We live in a global village. TB anywhere is TB everywhere. It's the perfect time to have a public health conference because people have not been able to meet in person during the COVID pandemic. And many things have fallen apart as a result of the pandemic in terms of tuberculosis, especially in Alaska, where they're now experiencing a real big spike in TB cases in the northern region.
One of the biggest challenges that we have, that's how remote some of the communities are, that aren't getting the services that they are needing. We have people in the coastal area that haven't gotten the services because of maybe no money. The only way to get to those communities is by plane or snow machine and dog team in the wintertime.
It was suggested to us by our friends at the Anchorage Health Department. Their staff was looking for some training in TB, case management and follow-up. And they said that if we were to be able to find appropriate persons to provide that expertise as part of the conference, they'd have their staff attend and take that training. So that seemed like a great idea for a sort of a satellite series of sessions about TB case management. And at the same time, it turned out that Qiagen was interested in being a sponsor to share information about TB testing and the like with the conference attendees. So it ended up fitting together really nicely to give us a full day in the middle of the 3-day conference, really largely devoted to tuberculosis in Alaska. And I think, certainly for myself, not being really a public health worker immersed in public health, it was kind of eye-opening to me how long TB has been such a huge problem in Alaska, and it's something that a lot of us kind of ignore and are lucky enough to be able to ignore.
All the specialties, when they come across, they need to screen for TB. They need to test for it. It's simple to do now, and they can move forward with that. And that's the way we're going to get to elimination, by preventing as many cases as we can.
Qiagen. Sample to insight.